Hey everyone, it's Twin Bui and welcome back to my channel. Today we're diving deep into the world of acne. We've all been there, those pesky bumps and blemishes that just seem to pop up at the worst times. Before we begin, please be sure to subscribe and turn on your notifications to get updates as new videos are published. Like, share and comment. Now let's begin. We're going to explore 6 common types of acne, understand what causes them, and most importantly, how to tackle them head on. Whether you're dealing with a few blackheads or battling more stubborn breakouts, this video's for you. Let's get poppin'.
First up, we have acne vulgaris. Don't let the fancy name intimidate you. This is just a medical term for the most common type of acne we see. Think of it as the common cold of the pimple world. Acne vulgaris is all about those blackheads, whiteheads, and those red, angry pimples that like to say hello at the worst possible moments. You'll usually find these unwanted visitors setting up camp on your face, chest, shoulders, and back. Now for some good news. Mild cases of acne vulgaris can often be managed with over-the-counter treatments you can find at your local drugstore. But if you're dealing with a more stubborn case, it's always best to call in the reinforcements and see a dermatologist. They can whip up a treatment plan tailored just for you, whether it's prescription creams, oral medications, or other therapies. Remember, you don't have to fight this battle alone.
Let's talk about comedones, the tiny troublemakers that often kick off the whole acne process. These little guys are often the first sign that something is going wrong with your skin. Imagine your pores as tiny tunnels in your skin, each one playing a crucial role in keeping your skin healthy. Now, picture those tunnels getting clogged up with a mixture of oil, dead skin cells, and sometimes even bacteria. This blockage is what leads to the formation of comedones. That, my friends, is a comedone. These can appear as either blackheads or whiteheads, depending on whether the pore remains open or closed. There are 2 main types of comedones, open and closed. Open comedones are what we commonly refer to as blackheads, while closed comedones are known as whiteheads. We'll dive into those in just a bit, but understanding the root cause is essential for effective treatment. But first, let's talk about what causes these pesky clogs in the first place. Knowing the cause can help us prevent them. Our skin naturally produces oil, also known as sebum, to keep it moisturized and protected. This is a normal and necessary function. But sometimes, our skin goes into overdrive and produces more oil than it needs. This excess oil can create a perfect environment for comedones to form. This excess oil can mix with dead skin cells and get trapped inside our pores, forming a plug. This plug is the starting point for acne. And to make matters worse, some products we use on our skin can actually make this situation worse. These products can contribute to the clogging of pores. We call these sneaky culprits comedogenic products. They contain ingredients that are more likely to clog pores and contribute to breakouts. It's crucial to be aware of what you're putting on your skin. That's why it's so important to look for products labeled non-comedogenic, especially if you're prone to acne. These products are designed to be safer for your skin. These products are formulated to be gentler on your skin and less likely to cause breakouts. They help maintain a healthy balance. Remember, knowledge is power when it comes to fighting acne. The more you know, the better equipped you'll be to tackle these skin issues head on.
Now let's talk about those little black dots that often pop up on our noses and chins. Blackheads. They're a type of comedone, but unlike their closed counterparts, blackheads are open at the surface of the skin. Think of them as tiny, open pores filled with a mixture of oil and dead skin cells. Now you might be thinking, if they're filled with dirt, why are they called blackheads and not dirtheads? Well, here's the thing. It's not actually dirt that gives them their dark color. The black hue comes from a chemical reaction that happens when the oil and dead skin cells inside the pore are exposed to air. It's like a mini oxidation process happening right on your skin. The good news is that blackheads are usually pretty easy to treat. Over-the-counter cleansers and creams containing ingredients like salicylic acid or benzoyl peroxide can help to break down the oil and dead skin cells clogging the pores. And if you're looking for a more hands-on approach, You can also try using pore strips or gentle exfoliating scrubs to help lift away those blackheads. Just remember to be gentle and avoid scrubbing too hard, as this can irritate your skin.
Chapter 4. Whiteheads. The undercover comedones. Let's move on to those small flesh-colored bumps that lurk beneath the surface of the skin. Whiteheads. Like blackheads, they're a type of comedone, but instead of being open at the surface, whiteheads are closed. Imagine a tiny closed sac filled with oil and dead skin cells trapped beneath the skin's surface. That's essentially what a whitehead is. Because they're closed off from the air, the oil and dead skin cells inside don't undergo the same oxidation process as blackheads, so they don't develop that characteristic black color. Instead, they appear as small, round bumps that can sometimes be difficult to see, especially on fair skin. While they might not be as visible as blackheads, whiteheads can still be just as annoying, especially when they decide to pop up in clusters. The good news is that many of the same over-the-counter treatments that work for blackheads can also be effective against whiteheads. Look for cleansers, creams, and spot treatments containing ingredients like salicylic acid, benzoyl peroxide, or alpha-hydroxy acids, also known as AHAs. These ingredients can help to exfoliate the skin, unclog pores, and reduce inflammation.
Chapter 5. Papules, when things start to heat up. Now we're moving into the realm of inflammatory acne, where things start to get a bit more serious. This is where acne can become more than just a minor annoyance and start to affect your confidence and comfort. Papules are a type of inflammatory acne lesion that develops when comedones become inflamed. These are not just simple blackheads or whiteheads anymore. Remember those clogged pores we talked about earlier? They are the starting point for many types of acne. Well, sometimes bacteria can get trapped inside those clogged pores and start to multiply. This bacterial growth is a key factor in the development of inflammatory acne. This can trigger an inflammatory response from your body, leading to the formation of papules. Your immune system reacts to the bacteria, causing redness and swelling. Papules appear as small red or pink bumps on the skin that are often tender to the touch. They can be quite painful and are a sign that your skin is fighting an infection. They're like little volcanoes erupting on your face, but instead of lava, they're filled with a mixture of oil, dead skin cells, bacteria, and inflammatory cells. This combination makes them particularly stubborn and difficult to treat. Now, here's the thing about papules. They're best left alone. Touching or picking at them can introduce more bacteria and worsen the situation. I know it's tempting to pick or squeeze them, but trust me, it's not worth it. The short-term relief is not worth the long-term damage. Picking or squeezing papules can actually make the inflammation worse and increase your risk of scarring. Scars can be permanent and much harder to treat than the acne itself. Instead, focus on keeping the affected area clean and using gentle, non-comedogenic skincare products. These products are designed to not clog pores and help reduce the risk of further breakouts. If you have a lot of papules or if they're causing you discomfort, it's best to see a dermatologist. They can provide professional advice and treatment options tailored to your specific skin needs. They can prescribe medications to help reduce inflammation and clear up your skin. These treatments can make a significant difference in managing and improving your acne. Chapter 6. Pustules, the pimples grand finale. And finally, we arrive at the grand finale of the acne world, pustules. These pesky little bumps are often the most noticeable and can be quite bothersome. These are another type of inflammatory acne lesion that develops when a comedone becomes inflamed. But unlike papules, pustules are filled with pus. This pus is a mixture of oil, bacteria, and dead skin cells. Think of them as the more advanced stage of a papule. While papules are red and swollen, pustules take it a step further by filling up with that white or yellowish fluid. They're like little whiteheads with a red ring around them, and they're usually filled with a white or yellow fluid called pus. This makes them more prominent and often more painful. As tempting as it may be, it's crucial to avoid picking or squeezing pustules. This can be hard, especially when they look ready to pop, but it's important for your skin's health. Picking at them can push the infection deeper into the skin, increasing inflammation and the risk of scarring. This can lead to long-term damage that is much harder to treat. Plus, it can introduce more bacteria into the area, potentially leading to more breakouts. Keeping your hands away from your face is a good practice to prevent further infection. So, what's the best way to deal with pustules? The key is to maintain a consistent skincare routine. Similar to papules, it's best to keep the affected area clean and use gentle, non-comedogenic skincare products. These products won't clog your pores and will help reduce inflammation. You can also try applying a warm compress to the area for a few minutes at a time to help draw out the pus. This can soothe the skin and promote healing. If you have a lot of pustules, or if they're causing you significant discomfort, don't hesitate to see a dermatologist. They can assess your skin and provide a tailored treatment plan. They can provide you with the best treatment options for your specific needs, which may include prescription creams, oral medications, or even in-office procedures. These treatments can significantly improve your skin's condition and prevent future breakouts.
That's a wrap on acne. So there you have it. A crash course on 6 common types of acne. Remember, knowledge is power when it comes to taking care of your skin. By understanding the different types of acne and what causes them, you can make informed decisions about your skincare routine and seek professional help when needed. And remember, everyone's skin is different, so what works for one person may not work for another. Don't get discouraged if you don't see results overnight. Be patient, be consistent with your skincare routine, and don't hesitate to reach out to a dermatologist if you have any concerns. Until next time, stay beautiful, stay informed, and keep those pores popping.